This is the Erasing Shame podcast. My name is DJ Chuang, and I'm with my co-host, Helen Choi. And today we are going to talk about how do you heal from racialized trauma. And we are honored to have our special guest, Jamilah George, who is a native of Detroit, Michigan. And she obtained her bachelor's from the University of Michigan, her master's from Yale University, and completed intensive pre-doctoral study on the Clinical Neuroscience Research Unit in the Yale Department of Psychiatry. Wow, you've done a lot and you're doing more, Jamilah. So glad to have you here. She is now pursuing a PhD in clinical psychology at the University of Connecticut. Her research interests include obsessive compulsive and related disorders, the psychological effects of discrimination and racial trauma of people of color, the neurological underpinning of these disorders, and the potential promise of psychedelic medicine as a means to healing. Jamilah's passion for social justice and equality issues fuels her work as she advocates for the mental and holistic well-being of socially disenfranchised groups, including women, people of color, impoverished domestic and international communities, and the intersections within. And our theme this season has been Journey Around the World, Journey of Healing Around the World. So you bring a lot to the table, and we're thrilled to have you join us for this conversation. Thank you, Jamilah.
Thank you for having me. I'm excited to be here today.
That's awesome. Well, we're we're equally excited to have you since we're recording this on the National Day of Racial Healing, just right after Martin Luther King Jr. Day, which is a big day to honor and highlight some cutting-edge work and research by, the selfless dedication of someone like yourself. So we're really excited to have you on board. And just going right into the interview, please tell us, why do you do what you do and your current work?
So my current work is multifaceted, I would say. As you heard in the bio, I am interested in obsessive compulsive disorder. Some of my work has dealt with the role of transcranial direct current stimulation, which is a non-invasive neuromodulation technique. So I've done a lot of work with figuring out the impact of what we call TDCS and moderating or minimizing symptoms of OCD. And I want to expand that work to understanding its role in trauma as well, in dealing with emotion regulation. So when a person experiences a traumatic event, as we know, there are a number of symptoms that tend to follow that traumatic experience. And so I'm interested in thinking about how TDCS can help minimize the response that a person has to a trigger after a traumatic experience. So that's kind of one of the projects I'm working on. I'm also still really heavily involved in thinking about the role of psychedelic medicine in treating racialized trauma specifically. And so I've done work utilizing MDMA assisted psychotherapy. I'm doing research on the role of psilocybin as well, ayahuasca, and other forms of psychedelic medicine. And I want to I want to bring healing to the people who don't have access to it. And so a lot of my work is figuring out how to create opportunities for people who would otherwise not have access to treatment to have access to treatment, and how to minimize, barriers and stigma that often prevent that treatment from going forward. So kind of at the end of the day, I think all of my work is really just driven by a strong desire to affect change. I grew up in an area, I'm from Detroit, Michigan, so I grew up in a lot of poverty. I grew up among a lot of mental health issues, and I saw firsthand, just how systemic oppression and systemic racism and discrimination can really just disenfranchise an entire race. And so there's like a fire in me, social activist in me as well. That kind of really undergirds the research that I do, the clinical work that I do with clients, to really make a difference and to bring healing to people.
Mm,
So, yeah, I feel
that's
very
Thank you.
awesome.
blessed to do this work.
Yeah, as I listen to you describe your work, it sounds like the work of an army. So I don't know how you're able to do that by yourself, but really
Yeah,
appreciate that
it's a
you
lot.
have
I
this
certainly
opportunity.
support at the University of Connecticut, and I have strong, wonderful advisors who've been here to support my work, but it's a lot.
Well, it's very important work, and you described the term racial trauma several times. So,
Yeah.
for our listeners, take a moment to explain what is racial trauma, and is it related to racism, and what happens to a person?
Yeah. So racial trauma is a term that we utilize when a person has experienced trauma as a result of racism specifically. It often refers to events of danger that are related to, racial discrimination, threats of harm, injury, racially motivated verbal or physical threats, humiliation, right? So there's that firsthand experience, but then there's also the witnessing part, witnessing someone experience harm, who's a part of another ethno-racial group. Um, so people of color experience racism so frequently, and as a result of that, unfortunately, it has a significant bearing on not only our emotional well-being, but our physical and physiological well-being. And it has a cumulative effect in the form of several small occurrences of discrimination or microaggressions, right? And we could talk more about microaggressions in a minute, but basically at the end of the day, you think about racial trauma, it's a trauma or a series of traumatic symptoms as a result of racism.
Yeah, and even the word trauma, some people may not realize that they've been traumatized
Hmm.
from some um, racialized incidents when it's not overt and
Right,
intentionally harmful.
right.
So, and when they have that, they might feel there's something wrong and they're shameful to talk about it, and they're silent, and it just festers. Why is it hard to talk about?
Oh, oh man, so many reasons. I think at the end of the day, it's similar to reasons why it's difficult to talk about, any other traumatic experience, right? There's this fear that people won't believe you, or there's this response that often minimizes or diminishes a person's experience or invalidates a person's experience. So, as a person of color, you try and express that you're experiencing racism or, discrimination in the workplace or, some sort of racially motivated behavior, and the person you're talking to is like, "Oh, I'm sure they didn't mean it that way." How? I mean, they probably would have said that to anybody, and you're just sitting there going, I know what I felt. I know what I saw. I know what happened, right? So you don't want to feel that devaluing, that minimizing in that way. So it's just easier to not say anything, and it's unfortunate. But you think about other victims of trauma like sexual assault. How many times has a woman come forth and said, "I was sexually assaulted by this man," and no one believes
So
her.
yeah, I really appreciate you just basically unpacking how racism, and not just racism, but sexism, and your lived experiences of overcoming systemic poverty, and how all of that, like just the logic behind this diminishing, devaluing, and essentially gaslighting, and not believing, the accumulation of that leads to trauma. And the reason why I'm really passionate about this topic as much as you are is because I am a survivor myself, and I
Yes.
have been diagnosed with PTSD.
Hmm.
And upon my research, I've come to learn that the diagnosis of PTSD is actually secondary next to diagnosis of depression. Depression is like the number one diagnosis
Hmm.
of mental health here in Canada, and interestingly, PTSD is number two here in Canada. I don't know what the facts are in America, but this is not a trend. This is uh, this should be of as much as we take care of our health, we should take care of our mental health as well.
Absolutely.
Take it seriously. So
Yeah.
so having said that, you being, on the cutting edge of treatment and care and sensitivity to the impact of um, racialized trauma,
Mhm.
um, and we will share this in our show notes about the Psychology Today magazine article. But in your uh, in your work that you do, how would you go about treating racialized trauma for healing and recovery?
So, unfortunately, racial trauma has yet to be acknowledged as an actual um, cause of trauma. Um, and we know that racism causes trauma. In fact, racism in and of itself is often traumatic, right? So we see a person of color experiences a racially motivated action that's traumatic, and they develop race-related stress, and that stress leads to race-based trauma. Or so, and that's really similar in any form of PTSD. It's like a series of events. Something happens to you, you experience a number of symptoms that lead to stress. So I'm thinking about an example like a really common one that I experienced as a Black woman,
Mm,
um, driving my car. And it's something that my mom called DWB when I was a kid, or also known as driving while Black. So you're in your car and everything is fine. And all of a sudden you see a police car behind you. So now you're like, you're sitting up, right? And, you straighten up and make sure your seatbelt is on. And did I, where's my license and where's my registration? And I want to make sure it's not in the glove compartment, because if they pull me over and I reach for the glove compartment, they might think I'm reaching for a gun because I'm going to shoot them. So they shoot me first. So now so you're freaking out, you're stressed, and you're terrified because you don't know if this police officer is going to pull you over and if that is going to literally end your life. So you're stressed, your heart is racing, and you're starting to sweat, your hands are slipping on the steering wheel, right? And you're anxious. These are symptoms of trauma, right? And so that is an example of a racially or race-based trauma, a trauma that is the result of an action that was rooted in racism. It doesn't make any sense that a person gets pulled over for not using their blinker, Sandra Bland, a traffic stop of the sort, and it ends up being the end of that person's life. So
mm,
you, as a person of color, as a Black woman, as a Black person, I'm living with this trauma, and this police car
mhm,
is a trigger for that trauma, right?
mhm,
And
mhm,
so that's really one of the ways that we see an experience leading to stress, leading to trauma. And when you don't talk about those experiences, it doesn't minimize the fact that they happen every day. It doesn't make them go away, right?
mhm,
So in thinking about treatment, one of the
mhm,
things we really need to do is have a safe space to talk about these experiences, right?
mhm,
So when people of color enter a therapeutic context, whether it's a clinical psychologist, a psychiatrist, a therapist, a counselor, whomever, it's often the case that clinicians are underprepared for the experiences that they hear. They
mm,
don't hear them at all because a person may not feel safe enough to share that experience, right?
mm,
I would say, as far as treatment goes, clinicians have to concern themselves with becoming culturally competent, right?
mm,
With learning to ask difficult questions, with learning to initiate difficult conversations, with learning to acknowledge the differences between themselves and the client who is a person of color, not pretending that that person of color is just like everyone else and that they don't see color. Because let's be
mhm,
honest, you see the color, right? And that
mhm,
color makes for a different lived experience than yours. So my dream is that these programs, these PhD programs, these doctoral programs, these supervisory programs are implementing treatment that is culturally competent so that we can learn to speak about our experiences instead of living with them and having this shame, right? As your podcast caters to, there's shame, there's fear, there's guilt, right? And so we need to be in a space that's safe enough for us to speak freely so that we can start taking steps toward healing. And unfortunately, these predominantly white spaces are often too toxic to accommodate that type of freedom.
Well, speaking of that, I guess I hear often from people that want to be supportive. Um, and this question of support is very broad because you kind of have to discern who is safe or not, who is an ally, or who is just kind of being nosy or intrusive.
Yes.
So for our listeners who are recovering from racialized trauma, what are some key indicators to sort of, because reading the Psychology Today article made me realize that one of the symptoms of PTSD based racism is just avoidance altogether because of fear. But you also need that support to be able to talk about it, that empathetic listening.
Yes.
So I guess it goes back to how do you know who is safe and is truly supportive?
That's such a good question. And I ask myself that question every day, walking in the halls of a predominantly white institution in a predominantly white space that is blatantly racist on multiple occasions. In fact, on this campus specifically, recently there was a racially motivated act of hatred geared toward two or three Black students, or actually a group of Black students. There were two white students walking and yelling racial slurs at the Black students while they were in their apartment. And it was caught on camera and it went viral. And so it feels unsafe. And not just here, but it's hard to find a safe space. So I constantly find myself asking, is this person safe? Because you don't really know when you're looking at a white person, to be completely frank with you, what they're thinking of you, how they're perceiving you. What do you think about my hair? Do you think it's too nappy? And my hair is not nappy, right? But we see that Black women have been asked to straighten their hair or to change their hair, or have even been fired. Black men as well, because of the style of their hair. So when you're looking at a person, you really don't know what they're thinking of you, which is why you see, you want to present your best self. You want to appear clean and fresh and well groomed and professional, and and all of this work goes into kind of trying to perform to the standard of whiteness, and almost the result of that often leads to kind of a denial of yourself or your own culture, your own being, the things about you that make you who you are. So that question, the honest answer is that there really is no answer. The real answer is that you just have to kind of go on good faith and hope and believe that people are being genuine. But the truth of the matter is, we see with microaggressions, right, and unconscious bias, that people have these held beliefs they don't realize come out, and they don't intend for them to come out. So I'll give you an example. I was getting ready to participate in a study. Actually, I wasn't doing the conducting this time. I was going to do a study, and made a phone call. And the woman asked, all these questions: "What's your race? Or what's your name, date of birth, whatever? What is your race?" I said, "Black." And she said, "Oh, wow, you speak so well."
What?
So it's like, are you surprised that I'm Black because I speak well? That's extremely offensive, right? So I'm sure she didn't mean anything by it, but that's a prime example of a microaggression. Someone who, seemingly has no idea that they're doing something offensive. It's a subtle, unintentional thing that they might have said or done, but is really offensive to the other person.
Mm.
So if I had $1 for every time I experienced a microaggression, I would
Mm.
have a lot of money right now. I really would.
Mm.
So I think I honestly try and give people the benefit of the doubt.
Mhm.
Um, I try and, you know, you know, have grace and compassion and say, maybe they didn't mean it that way. And I might have taken that, depending on the time and the place, depending on the event, I may take that as an opportunity to say, that was pretty hurtful. And
Mm.
here's why, briefly. I'm not going to go on and on because it's not my job as a person of color to educate white people, right? There needs to be, the onus is on them to educate themselves as to why what they might have said or done is offensive to people of color. So I would just say briefly, it seemed to me that you assumed that because I speak well that I'm not Black. I couldn't be Black because I speak so well. And that was hurtful. Something just simple like that. And then she might apologize, and then it's okay. Let's just keep moving forward. I don't, because now you apologizing. Oh my God, I'm so sorry. I didn't mean that at all. And oh my God. And then I have to say, it's okay. And now I have to soothe you after you hurt me. It's not my job to do that. So I just say, try to give people the benefit of the doubt, take the opportunity to educate minimally and keep it moving, because otherwise this will overtake you. It will develop into stress and anxiety, and it'll drive you crazy.
Mm.
Well, you've answered my question about how do you respond to people saying that, oh, they're colorblind and they didn't mean it that way, but it happens because it's so baked into our culture
Yes.
for centuries. I mean, America
Centuries.
was founded as a racialized society, and
Yes.
colonization against the First Nations people and
Mm.
all those atrocities of taking their land and a lot of slaughtering and killing and just terrible things.
Terrible
And we're
things.
still living in the shadow of that.
Yeah.
And man, and for us as Asian American, we get that response a lot. I came to the U.S. when I was 8,
Mm-hmm.
and so there are people that occasionally will say, "Oh, your English is so good," or the more common comment Asians get is, "Oh, where are you from?" And I might say Virginia, which is where I grew up.
Right.
And then they want to say, "Where are you really from?"
Right.
Meaning that they see that I'm Asian,
Right.
but they want to do something with that. And yet they say they're colorblind. So if they're colorblind, then why does my color matter?
That's right.
What's up with that?
Yeah. I'm really sorry that you've had that experience, because I know the pain that inflicts upon you when you're forced to be made to feel like an outsider, like you're a foreigner, like you don't belong, like you don't have every right to this country that they have. I say, for people of color, we experience that so frequently, like you mentioned. It happens so often that it's really important, I think, as a way to protect ourselves, is to find our tribes, is to find the communities, to find the people who support you and who uplift you and who encourage you to be who you are, and not to shy away from any part of that, even if some part of who you are makes people uncomfortable. I am sick of having to tailor myself in order to make white people comfortable. And I just won't do it anymore. So, and it's hard to take that kind of stance alone. So, for protection, there's power in numbers. I say, you know, galvanize the people who you love and who help you to feel most like yourself, and um, and live in your truth. Live wholly in your truth. If you have an accent, if your hair is kinky, if your eyes are thin, if your nose is wide, whatever part of you that makes you identifiably ethnic, embrace that and live in that truth, because that is who you are. I think living in truth protects us from pain. And living in truth requires community. And so you think about resilience. You think about the things that make people resilient. Oftentimes it comes from their community, whether it's a church, often communities of color. Church membership is important. That family and ethnic minority communities, extended family is important, right? So it's more than just mom and dad and siblings. It's aunts and uncles and grandparents. And oftentimes in Black families, you have close friends who aren't really your family, but you call them Uncle Ben because, blood wouldn't make you closer, right? So you find those communities and you stand tall in your truth.
That's so neat to hear you say that, because we do that in the Asian culture too. Call our relatives uncles and aunts.
Yeah,
So neat to hear the Black folk do that.
Absolutely. We surely do. It's a mechanism of protection. You gotta find the spaces that are safe. We talked about the lack of safe spaces that many of us endure on a daily basis. So when you leave that classroom, you leave that executive board meeting, you leave that room wherever you were, you gotta find the space where you can walk into and just take a deep breath, take that mask off, right? But the real goal is to get to the point where we don't have to feel like we need to wear masks anymore. But right now, it's a defense mechanism, it's a mechanism of protection, and a mechanism of safety in a world that is so toxic and so painful, is so full of hatred and racially motivated behavior that leads to trauma and traumatic symptoms. I still have a dream.
Amen. And I love the strength of your words and how you're standing strong and who you are and the truth of that. And I know that's going to cause, or that probably has caused some people to be uncomfortable and not sure what to do with that. And you don't have all the time and energy to explain everything, but you stay strong. And I hope that you do have the support around you so that you can't keep standing strong. And some other people will have to figure out how to do that educating, and we definitely need more conversations to do that. So
That's right.
thank you for sharing all of that. I feel powered.
Thank you. Thank you. And I know that cultural competency and cultural humility beyond cultural competency is on the leading edge of intercultural counseling as a form of healing.
Yes.
Moving away from dominant culture's way of teaching counseling, and in some aspects indigenizing.
Excuse me. Sorry.
It's all good. Bless you.
Thank you.
But I guess you're obviously very passionate about what you do. So how can our listeners find you and support you in the work that you do in this cutting edge work of bridging the divides and being an agent of healing and reconciliation?
Well, I'm a very interpersonal person. I would much rather to hear from people. People email me from all over the world saying that they've read an article that I've written, and that they want to communicate with me. So people can just email me directly. Maybe we can make sure it's listed on the site, but it's Jamilah JAMILAH.George at UConn.edu. Working on a website. I have my page of my research is up on the UConn website so that people can see my current publications. And if you just Google me, you'll see there's a page. I'll send some resources for you so people can find me directly. But there are resources for trying to get access to psychedelic assisted therapy. And hopefully soon that'll be a treatment modality that we can offer here at our clinic here in Thailand under the direction of Dr. Monica Williams. She is kind of helping to facilitate that stage of therapy. And we're not there yet, but we're getting there. We're working on FDA approval for MDMA assisted psychotherapy. And that is groundbreaking. We, so far in our study, we've only had a few participants, but from what we've seen in our particular study, the studies have been going on for years and have shown promise for treatment resistant trauma. So these are people who have attempted several other types of therapy, exposure response prevention, other forms of psychotherapy, cognitive behavioral therapy, neuropsychopharmacology. I mean, just all kinds of things, and they haven't had success. So for these types of people who have severe trauma, we are seeing substantial improvements. I mean, I'm talking about CAP score, so the measure that determines severity of post-traumatic symptoms. You're seeing it go from the double digits to 50s, 60s, 70s, dropping down to the teens and even single digits. So these are people who have trouble sleeping at night, have trouble driving, experience flashbacks, nightmares, may have lost their family, right? These are the most severe post-traumatic stress patients. And we're seeing such substantial recovery. So we're still in the clinical drug trial phase, but there is promise. I believe that there is promise if this drug has been shown to be effective for predominantly white groups. We're interested in seeing why wouldn't it be effective for healing racial trauma and people of color. So that work is on the horizon, and there's a lot of work being done in the background. So people should stay tuned to that, because when that treatment becomes available, I'm going to do everything in my power to make it accessible, because I really want to see people of color who are suffering have access to healing and have a better quality of life in the same way that the 1%ers of our society have access to these treatments, right? Some of them have access to these drugs because they want an experience. They want to go into the mountains and just explore and get to know themselves. So people of color don't have that same privilege. We don't have that same societal and cultural power. So we have to have it in a clinical medical setting. And I'm fine with that as long as the result is healing. So we're working on it. Stay tuned. Please be in touch with me via email. And I'd be happy to make myself and all of my resources available as best as possible.
Thank you. On a final note,
Yeah.
a big theme of Journey of Healing for me is on forgiveness. I know, I didn't really get to touch upon that, but just for you, just as a woman of color, and we talked about the microaggressions. How do you sort of find the balance of forgiveness, letting go, but at the same time seeking remedy from injustice?
I think, first of all, as a Black woman, I had to learn to embrace my response to the overt hatred, racism, and discrimination that I have experienced. I think it's unrealistic and it's unethical and it's unfair for people to expect that any racial group, ethnic racial group, experience that type of hatred and to not become angry. I think it's important for me to embrace the fact that my response is anger and frustration and other emotions, maybe sadness, maybe fear. But whatever that authentic response is to the hatred that you've received is valid. We live in a culture that fails to validate our responses to the systemic institutional oppression of this society. And it's not fair. So I want to validate within myself and within you and with everyone who's listening that your response is valid, that you have every right to be sad, to be furious, to be angry, to be fed up, to be disappointed. Whatever your response is, it's valid. So that comes back to living in your truth. What is your truth? The truth is that racism is painful. Racism is traumatic. Racism is infuriating. Live in that truth. Acknowledge that that is the truth for you. I think is step one. And then two, that's when you can begin to forgive. Only once you acknowledge the truth. And maybe you aren't angry about what's happening in our culture. And if you're not angry about racism, I would challenge you to dig a little deeper because it's infuriating. So starting with that truth, only then can you begin to open your heart to have compassion and to have empathy. Because if you don't acknowledge how you feel, what you end up doing is suppressing it. You suppress it. You just push it down deeper and deeper. And we see that in our culture. We see that in psychopathology. People have anxiety, people have depression, people have trauma, people have bipolar, people have a number of different psychopathologies and don't have the liberty to speak about their experiences. So they just suppress them. And what happens eventually, it comes out. Eventually, you can only suppress it for so long. And after a while, it's going to come out. And maybe it's going to come out in a way that's less controlled. Maybe it comes out in a way that you didn't intend. Maybe it comes out in a way that's more harmful than you intended, but it's going to come out. So I say, live in that truth. Allow your emotions to come up in a safe space. And then, and only then, can you open your heart to begin to have compassion and to forgive others. If you don't live in that truth, you'll be living in denial. And that only leads to more pain.
Thank you.
My pleasure.
Jamilah, you've said so many profound things, and it's so meaty. And I really appreciate how you've been fully present and you've spoken truth and words of healing. So I would encourage people that have given some attention to this episode to re-listen to it and really soak in some of the things you've said, because it is powerful. It is powerful truth. Thank you for sharing that with us and our listeners. Thank you, Jamilah. And we definitely will add your email and your current website. And if you have a future website, we'll update the show notes so that people can reach out to you. I love the work that you're doing. It's so important. We're going to cheer you on because I know that in the medical community, the psychiatry community, it is predominantly white. And we need people of color to do the culturally relevant as well as the lived experience to really make that more effective and more accessible to the majority of the world. Actually, the majority of the world is non-white.
Right.
And so we have a lot of work to do. So thank you for stepping into it. I know it's a very challenging thing, but we're cheering you on. And thank you for sharing a bit of your life with us.
Thank you for having me. That means so much to me.
Thank you. We get a big heart. Thank you from Canada.
You get one right back.
we get a big heart from Canada. We love you.
Excellent. Thank you so much.
Thank you.
Thank you all for this podcast and for the work that you're doing. It's truly phenomenal and it's necessary. And I can't wait for the world to see the work that you're doing. It's urgent. We need it.
Thank you, Jamilah. And to wrap up this episode, for you listeners and viewers, please subscribe to us on YouTube, on Facebook, and at erasingshame.com or any podcast channel that you listen to, whether it's Apple or Stitcher or TuneIn or Google Play. And please review and rate so that other people can find this podcast. We have had 4 seasons plus a special series, especially on mental health. And together we can bring about the journey of healing around the world as people experience the erasing of shame and stepping out of that darkness and into the light. So thank you for listening, and we'll be back in a few more weeks. And you have a great day, a great night, wherever you are. Thanks for listening.
Bye-bye.
Bye.